Welcome back to The Health Coach with Dr. Nick on Hunters Bay Radio. And we're we're talking about anxiety with Elke Scholz, our therapist, author. So anxiety, when my patients come to talk to me about anxiety, the way they describe it to me, I guess it's almost, I hate to say it this way, but they're almost victimized by the workings or dysfunction of their brain. I have anxiety. My brain does not work well. Therefore, I need these medications to control my anxiety. And that may be one point of it. That may be part of it. But there's many, many other things.
It's interesting when you say that, because I'm of a different approach.
Mm-hmm.
So what I say is anxiety is useful. Bring it in. And
bring it in.
And people just go, their eyes get big. They're going, what? I've been trying to push it away. I'm trying to medicate it. I'm trying to get over it. I'm trying to get past it. I'm trying to make it go away.
Yes.
Well, it's the opposite. Bring it in. It's trying to tell you something.
Okay.
And then you just go, wait a minute, whoa.
So maybe just as a quick example, what could it be telling us?
Well, you know what? Very simply, chemically, if your brain does not have enough water, it will give signals similar to anxiety.
It could be simple as that.
It could be as simple as that. And I had one person call me. They were so anxious. They were off the tree. They just couldn't think. They were so sick. And it was the afternoon. And I said, what have you been eating all day? And she just said, I've just had coffee because I can't eat. I'm so nervous.
Okay.
And I said, what if you didn't have coffee? Can you try that for a few days and call me back? And you know what? She did. She did call me back. And she went through the headaches.
Yes.
And she said, unbelievable. I thought it was anxiety. So for her, the caffeine created a symptom that was like all these, the butterflies, the stiff neck,
heart palpitations,
the shaking, the heart palpitations.
Sure. Okay.
And so sometimes what we have to look at, and I want to say every body is different. So you need to know what your body signals are. So that's where, you've got to look at what are you eating and notice, do you get anxious? Like, do you wake up anxious? Well, then maybe it's a different cause. If you're anxious, and have a glass of water, what happens to your anxiety? If you wake up and you're not anxious, but then you find you're anxious mid-morning and you've had 3 coffees, maybe it means you need to look at what you're having for breakfast. I know it sounds so simple, though I always look at the physical, what can we do immediately to lower your anxiety? And sure, there may be a whole bunch of other factors that contribute to anxiety, but let's look at the chemical and the physical first.
I think this is amazing because I know I have a lot of patients who come in and say, I'm stressed. They'll say they're stressed.
Yeah.
And then they'll say the next breath, but I don't know why I'm stressed. I shouldn't be stressed. I have nothing to be stressed about. And I think some of it could be that they have anxiety. Culturally, we shy away from mental health definitions.
Well, unpleasant feelings.
Yeah.
We shy away from unpleasant feelings.
Okay.
And we don't want to feel, and I say unpleasant. We use the word good and bad. I feel good, I feel bad.
Yes.
Which is a setup because really we could say I feel pleasant. And I feel unpleasant because feeling unpleasant, like grief, anger, sad, anxious, those are part of our human spectrum.
That's right. They're not bad.
So if we want to say, I feel bad and I don't want those,
yes,
that's really denying who we are and where we're going.
Because people watch sad movies.
Oh my gosh.
So is that feeling bad? It's feeling unpleasant, but they're choosing to do it.
Maybe they're connected. I don't know.
but okay, I get the point. Wow, this is fantastic.
So it's fun. It makes it a little more fun, and it is a different way of thinking. And then when you start bringing anxiety in as that it's a clue and an opportunity, and it's like tapping you on the shoulder and going, hello, what is really going on? So, and then we can keep going with some of these others. I don't know how much time we have.
Sure. So. I mean, okay, how about some symptoms or causes that people might not be aware of that you feel are pretty common? You hear about it over and over again, you see it over and over again, and people aren't making the link between anxiety and this. Okay, so anxiety and IBS, for example, irritable bowel syndrome, or anxiety related to, memories. okay, or cultural beliefs or social beliefs? Is there something that tends to be fairly common but greatly unrecognized?
I think there's lots.
There's lots. Okay,
yeah,
okay.
there's lots.
Good.
Well, you mentioned beliefs, and
Sure.
so like we have social beliefs and cultural beliefs.
Sure, let's go there.
And you know, like there's a little word that's inside of belief. Can you see it?
Lie.
Right.
Good job,
So-
Dr. Nick.
Yes.
Yes.
So what's so interesting is, and I'm not saying that every social belief and cultural belief is a lie. However, if the belief isn't working for you, a lot of times it does create anxiety. So
Wonderful.
there's owning your social and cultural belief, and it's I call it a truth in quotation marks. Is what is that truth? Is it your truth, or is it something that was told to you? And so I'll just name some with kids.
Sure.
You know, girls are supposed to be nice, polite, and actually that's even a Canadian thing. So, you know, we're supposed to be really nice people, and that's culture, and also a bit of social. So, though that can create a lot of anxiety. Like I do work with girls at risk, and so it's not cool for them to be angry or to swear or to have all these deep, hard feelings that they have. And that's a belief system. That's not the truth. And so then it creates anxiety because there's this inner battle of, this is how I feel, but I can't act this way. So now I must be a bad person, and we start ruminating, and we start on this circle of worrying of yes, no, I'm right, I'm wrong, but this is how I feel, but I can't feel this way, and then we start getting anxious.
Wow.
I mean, it's not that simple, but that's one. So, you know, you start
for sure.
adding some more social beliefs on that and piling it on, and all of a sudden there's this burden of, you know, who am I anymore? And our bodies are reacting because we're not knowing how to act anymore.
Yes. And
to be, or how to even listen to ourselves, right?
Okay. And I think that this could lead to now other self-destructive behavior. So to get rid of these feelings of anxiety and stress, then we turn to drugs or alcohol or food or whatever it is, right?
We try to self-medicate somehow and make it go away instead of looking at it. And again, too, I mean, this doesn't even deal with the underneath trauma. So I try to really, you know, look at first physical, the chemical, the reality. What can we do right now?
Okay.
What can we do to eliminate and lower some of those anxiety levels?
Okay.
And usually we can knock them down a few notches. Then we go into these culture and social beliefs.
Okay.
And, you know, I send people away with homework and say, okay, just watch yourself this week and think of a belief system. Because it's hard sometimes to think of them and how we were brought up. Being stoic is a belief system.
Yes.
You know, suck it up.
Get
over it.
Of course.
Those are, you know, toughen up. That's a belief system. So just kind of having people watch what they should be doing in quotation marks and what are they really feeling. And then we need to figure out a balance. And then, of course, there's underneath, it could even be trauma. So when it's memories and triggers, that's a possibility too. So, though I think the majority of us are hovering in those first ones.
Okay, so again, so just a simple thing. So someone is suffering from anxiety, you're saying they should look at, and with your help for sure, but maybe a quick checklist.
Sure.
Chemical, physical, and what's real? And we went over what's real. Maybe just go over a quick what physical thing could be leading to this again, and what chemical.
Well, chemically could be substances that you're sensitive to.
So you mentioned the coffee.
Or caffeine. And there's caffeine hidden in so many things. You really got to be a label reader. Different types of sugars. You know, find out what your tolerances are. Find out what your tolerances are for carbohydrates.
Gotcha.
I can't eat white noodles. It keeps me up.
Wow.
So, and that brings me to another physical symptom is lack of sleep, lack of exercise. We have those will create similar symptoms to anxiety or make them worse. It will exasperate them, right?
Got it.
So
I can speak to that. When I don't exercise, I feel anxious. Oh, I do, and my wife will tell everybody that's true.
Well, there you go. Yeah, so
interesting.
It is interesting, and like I said, it's been a fascination for me. And And then, of course, there's the reality.